So good morning, everyone. I'm Teresa Query with the Family Focus Resource Center. I am the coordinator of the Family Focus Resource Center that's located in the North LA County Regional Center in Chatsworth. For some of you that may not know, we do have Family Focus Resource Centers in Antelope Valley and Santa Clarita Valley. Our website is in the chat box. And also I wanted to let everyone know that please join us for our upcoming All Abilities Resource Fair, free virtual on October 23rd. We're so excited. This is the resource fair we would normally have in person at Cal State University Northridge, but we're not going to be able to have it there this year. So we're bringing it to you live, virtually, Saturday, October 23rd, and I'll put more information in the chat box. So let me get started by introducing Dr. Baily Zubel with Speech Language Educational Associates, and today's topic is on sensory development of young children, supporting participation and play. So with that, and I'll let you know also that we will be taking questions and answers. So if you have something you want to ask, just put it in the chat box and I will have our speaker, Dr. Baily, answer those questions. So with that, it's all yours. Thank you.
Thank you so much, Teresa, for having me. As she mentioned, I am Dr. Baily Zubel. I am an occupational therapist by trade, and before that, was an educator for K-6. We are going to go through the sensory development, and over the next hour and a half, feel free to stop me at any point, throw up a question in the chat box, and then we will get your answer. And a little bit more about me and my experience in this area. So I am I was an early start provider for many years. I do ongoing assessments or initial assessments at this point in that birth to 3 category, and I am sensory certified and hold early identification badges through AOTA. So that means that I've done a lot of coursework and worked a lot with the birth to 3 population over the course of my career as an occupational therapist. So we're gonna get into this. And by the end of today, I really want you to feel comfortable answering what in the heck is this sensory? What does it mean? What does it look like? What is sensory development look like? How can you help your child at home? And what are some activities you can do to help foster that sensory system and sensory development? So if you can't answer these, ask questions. I want to help you be able to answer these. So we're going to kick this off with what is sensory. I feel like it's a buzzword across therapy right now, and also just in general trying to figure out what's going on with these kiddos. I feel like sensory can often be that hidden component that really is impacting development and participation, and is one of those things that once you see it, you can't unsee it. So we're going to look at how to see it today. Sensory. So really the nuts and bolts of what sensory are, we are taking in information from our environment, processing it in the brain, and then making some sort of response. Everything we do involves sensory integration and processing. So we are taking in a sensation. It could be the light coming through my window. It could be the tick-tock of the clock. It could be the sound of the air conditioner, but it's taking in that information, our brain processing it, and then producing a response. The response may be to ignore it. The response may be to pay attention to it because it's giving us something about a dangerous situation we might be in or something of that nature. But it's what do we do with all of this information, and what does our body do with all of this information after we take it in? 1 in every 6 children have sensory processing difficulties. So it is not something that is uncommon. It is not something that is just seen as a comorbidity with autism. It is something that impacts a lot of people and a lot of children. And I think the most fun thing about sensory is that we can really make changes to the brain through play. So we can help children process all of the information they're taking in, organizing it in their brain, and then producing that response. We can help their bodies and their brains learn how to do that through play, which is a really fun thing. I don't think many professions get to say, I get to play for work. So when we're doing sensory, we really want it to be play-based, and those changes are made through play. So sensory integration in our world. If you look at this picture for a second, I want some participation because it's more fun that way. If you could either unmute yourself or throw in the chat box, what are some of the sensory components, or what are some of the elements in the world that are having to process to cross the street? So if you're going across the street, how do you know it's safe? Sounds. Yeah, so you can hear the cars around you. You can hear the people around you, whether or not they're going. The crosswalks often talk to you and tell you it's not safe to walk, or that it is safe to walk. There are symbols, so you can see the physical signs. You can see the stoplights. You can see the crosswalk signs. Sight, yes. And you have to know where, so you have to know where your body is on space. You have to know where the curb is, where the crosswalk is. You have to have that postural control to step off a curb or to grade the slope of the curb and then navigate the whole way across and back up safely. So there's so many pieces when we're thinking about sensory integration and sensory components, just to do something as simple as crossing the street. So you've got your visual system engaged, you've got your auditory system engaged, you've got your vestibular and proprioceptive systems engaged. You might have that olfactory system engaged. You might be able to smell the car exhaust, or a really stinky garbage truck just went past while you're waiting. So there are lots and lots of things and components that impact safely crossing the street, and lots of sensory stimuli coming in that we've got to siphon through to safely cross the street. When we're thinking about sensory, and as I talk about sensory, we're really going to be focusing on 7 senses. So there are the 5 that I think most of us have learned throughout our lives. And then we have these 2 hidden senses. So we've got hearing, so how you're taking in information through your ears, taste, all of those taste buds and receptors in your mouth that interpret salty, sweet, spicy, bland, all of those fun things. We've got touch. So we've got light touch receptors. So think these are more like your ticklish touch receptors. If you're touching your hand really lightly, we can activate those light touch. And then we've got some deep touch, right? They're a little deeper in, and they help us identify pain. So there's light touch, there's deep touch receptors. We've got smell, we've got sight. So those rods and cones in our eyes, our ability to see color and shapes. So there's all the acuity and then the color components. And then we have these 2 hidden systems. We've got proprioception and vestibular. And what does that even mean? We've never heard of these words before. We're going to dive into them. So these are the hidden systems. It's really hard to be like, okay, this is a tangible system, when it's something that, for the most part, isn't something we learn when we learn the 5 senses in elementary school. So proprioception is knowing where your body is in space. So it's your relationship to objects, to people, to things in your environment. How we sense our proprioception is through our muscles, our joints, and our ligaments. So this is we're getting that feedback about where we are in space. And it's also linked to that kinesthetic sense. So signs of possible proprioception, like processing difficulties, are, I call it the 3 Ps, the plop, prop, and pop. So these are our little ones that just kind of flop down. They pop up using momentum. So using those static muscle contractions is really hard. And then they're propping. So if they're at a table, on a high chair, they're leaning on the table, they're leaning on their legs. We don't see them sitting upright independently. And then we'll dig through this a little more, because if we're thinking about development, if we're looking at a 6-month-old, it's totally appropriate for them to be propping on their arms if they're in supported sitting, or if they're learning how to walk, to plop down on the ground. So there is a realm of what is developmentally in sync as well. Kiddos that have difficulty with proprioception can appear clumsy, and they use too much or too little pressure. So if we're stacking blocks, they might be slamming one block on top of the other, and the tower, they're just having a really hard time with building that tower because they're using so much force. And they're not trying to use so much force, but they're getting that feedback in their body by using that heavy force. Too little pressure, think of something like coloring. They might be coloring away with a crayon and you can't see it for the life of you. So they don't know how to make it a little bit heavier. I would say we have proprioception, right? There are people, like, I know for me, if I don't regularly work out, I might bump into the table or the door frame and I just kind of lose track of where my body is in space. It happens to all of us. We all have this sense. Some of us, it functions better than others. And some of us, we need compensatory strategies like going to the gym to keep this system really aligned. Another fun little hallmark we'll dig into a little bit more later is that proprioception is, in the therapy world, we call the universal modulator. And so what that means is if we are working with a child with sensory processing difficulties and they're upset, we're gonna go to heavy work in our knowledge of the proprioceptive system to help calm their body down. So the proprioceptive system can turn off some of those alarming neurons that put us in that fight or flight mode and cause some of those big emotional reactions. Questions or clarifying statements about proprioceptive systems before we roll on to vestibular?
Any questions? Okay.
All right, we're gonna keep rolling. The vestibular system, so it's sensing your body's movements. We have 2 fun little organs in our inner ear called the otolith and semicircular canals. If what they look like, it's kind of like jello with little hairs that indicate how our head's moving. So it gives feedback based on whether or not our head is upright, our head is tilted backwards, forwards, whether or not we are in motion, forward motion or backward motion, whether we're standing still or sitting still. Our vestibular system is sensing our movement and the speed of movement. For this is how some people can get car sick. Their vestibular system isn't interpreting movement the same way. So it makes it feel like they're moving more or not at all compared to what is actually happening. And so that discrepancy is what can cause some motion sickness. or it's why as adults we have a really hard time on roller coasters and going upside down, because that essentially that jello-y substance, it gets a little harder over the years. So it doesn't move as well with us. And so our bodies aren't feeling the movement the same way it used to, which is why we can feel some motion sickness after roller coasters. So we gain information from our vestibular system in our inner ear, and then signs of possible processing difficulties. It could be that your kiddo is sluggish. And so what I mean by that is you can plop them on the carpet and they will be in that spot in an hour when you come back. They like to stay in the same spot. They don't like to roam around the environment. They're really comfortable just being in their own personal space in that little bubble. And it can manifest the other way, right? They could be moving around and going so quickly and they're always on the go. So there's, just like the proprioceptive system, there's different extremes and different, there's a range and a spectrum of processing.
Can I ask a question? Because I suffered through this, and I wasn't found till much later that I had, because I would tell people, that I'm having this problem, but can you imagine a kid going through this and not able to verbalize that? Not until you said this is just really hitting home for me. I mean, I still have the problem, but growing up, no one really listened. I should have raised my hand. Okay, Leah, you raised your hand like a good student.
Yes, I did. I'm wondering, is vertigo under vestibular?
Mm-hmm. So it's
movements?
visual and vestibular systems.
Oh, I see.
And then
because
the neurological process with that.
Oh, okay. All right. I just think about it. It's, the vertigo.
Yeah.
All right.
And then, sorry, everyone. I hit my mouse. And then I see Maria's question. What are things we can do to help older children and adults? So we are gonna dig into that through this presentation. And things like, so if we go back to that proprioception and that universal modulator, that heavy work. So really engaging muscles, joints, and ligaments, and doing that heavy work can help with the vestibular system as far as neutralizing it if it is on overstimulated or understimulated. We want to get to that just right place, and we'll talk about how to get there. And then occupational therapists, especially for children, we specialize in this. So sensory is our bread and butter in pediatrics. And we are absolutely here to help navigate this, whether it's at home, in the community, or in like the school setting. So why is sensory so important? I wanted to look at this pyramid of learning by Williams and Schellenberger. And this shows, like, we have our central nervous system, and then the first layers are all of those 7 sensory components that we just talked about. So smell, visual, hearing, taste, touch, our movement sensing, and knowing where our body is in space. And then at the tippy top, we have academic learning, and then everything in between, right? We have eye-hand coordination skills, language, reflex integration. We have auditory processing, attention. So in this pyramid, I want to think of it like a Jenga tower. So we have our Jenga game set up. And if we are working with a child that has some difficulties with sensory processing, we are starting with the bottom pieces missing. So we're starting on that wobbly tower, and we're expecting to build up with, as we challenge them throughout the day. But if we're missing those foundational pieces, or those foundational pieces are kind of cattywampus, and they're pulled out or they're sliding out from our Jenga set, it's going to be really hard to build up our tower. So what we're looking at for sensory is really solidifying that foundation so that we can build up on that Jenga tower. And then just a side note, we learn when when our sensory system feels just right. So when we really tighten up the base of our Jenga tower, we can build up. So there can be activities to either help increase our level of arousal, decrease our level of arousal, or help us process that sensory input that help us feel just right to be able to move up that tower. So play. Children learn best through play. Play is work for these guys. Under the age of 3, they have 3 jobs: to eat, sleep, and play. And those are so critical for their learning, for their development, and for the sensory experiences. So play stimulates the brain. That's how they learn and experiment with the world around them. And it's also how they gain some of those preparatory skills. So, you know, as we're looking at what they do when they're playing, they're actively exploring, they're engaging with their environment. They're making connections between objects, between people. They're learning about cause and effect and how those things interplay. They build that spirit of curiosity, and they develop relationships. So rarely is play an independent piece. They're engaging with their caregivers, with their siblings. As they get a little older, they learn how to parallel play or engage and relate with peers. During the first 3 years of life, if we're thinking about the brain again and all those sensory experiences that are processed in the brain, about 80% of the brain connections that we have are made through play in the first 3 years of life. So it's really setting them up for future success with a play, like learning how to play and playing and engaging with them. Some other things we learn through play are, you know, that cooperation and relationship, through having to learn how to take turns and having to learn how to use that wait time. And then we also watch and imitate what we see around us in the environment. So we're watching new skills. We're watching people do something we can't do just yet. And then we start imitating and trying to learn how to do and master these new skills. So this is just a fun little quote that I love so much. And it really talks about why do we play? Scientists have recently determined it takes approximately 400 repetitions to create a new synapse in the brain. So to learn a new skill, if we are doing it through a rote task that is not meaningful, that is not fun, it takes 400 times to create that pathway in the brain, unless we do it through play, which through play, so when it's when they're doing it independently, when they're doing it, when they're motivated to do it, when they're wanting to do it through play, it only takes 10 to 20 repetitions. So for kiddos, rather than doing drills to learn a new skill for crawling or for walking or, you know, placing that block in the container, if we are just drilling them, it's going to take a long time. It's going to take a really long time to learn that new skill, because it can take 400 repetitions to create that pathway. But if it's done through play, we can learn that new skill in 10 to 20 tries. So play is so, so important. And that's just a little fun snippet from Dr. Karen Purvis's research. So play, it's so important, not just for fun, but for brain development as well. And it impacts that sensory piece. We are going to look at some sensory development. Before we go into the sensory development, any additional questions about just the general overview of what sensory is, what the sensory systems are, and what they look like.
Hi, can you explain the difference between like sensory processing difficulties versus an actual diagnosis of sensory processing disorder?
Yeah, so sensory processing difficulties looks like we all have them. So we all have good days and bad days. Our sensory systems, they're like, I would say they're like waves in the ocean. Sometimes, you know, they're just the little, they're the tides, and there's not those big waves crashing. It's really safe and easy to play and wade. And sometimes, you know, there's a storm coming in and those waves are crashing down. So depending on where your body is and how your body feels that day, you know, we can all have some sensory processing difficulties. For me as an adult, you know, I can have some sensory processing difficulties by bumping into a door frame if I haven't worked out in the last week. It is not uncommon to find a bruise on my arm or my leg because I've bumped into something if I haven't been working out. Or I can make choices as an adult, right? I'm not a huge fan of like blueberries, so I can avoid those. But so my sensory system has its likes and its dislikes, and we can navigate through. Where sensory processing disorder, it's impacting everyday functions. So these sensory systems are impacting day-to-day routines. It causes strain with the child caregiver relationship because I don't want to say everything feels like a battle for the parent. That's the wrong thought, but there are challenges in, you know, getting dressed, challenges with mealtime, challenges across going to sleep, or challenges with play. So you're seeing those patterns of challenges across the day. And just as a caveat, those are diagnosed by your pediatrician or medical doctor. So that would be the person to look to if you are concerned with some of these processing differences throughout the day, because it is impacting participation across the day, or is significantly impacting participation in a particular area.
Dr. B, we have a question for Leah. Is it Leah? Alea? You need to unmute yourself there.
Forgot that part. Okay, so when we're talking about processing of the sensory systems, it's not fair to say that it affects our feelings or perceptions or responses that we do every time.
Yeah, I would say it does impact that, right? If I'm getting sensory overload, if I am in a room that has music blaring and a strobe light going, my emotional reaction to something challenging to me, because I'm taking in all of that information, is going to be a lot bigger than if I'm in a quiet, like library environment in a private room and being challenged, because we get frustrated a lot easier with sensory processing if we are overloaded. So that is a great point. There is a link to the vestibular system and emotionality as well. So our ability to process emotions and that self-regulation piece is linked to the sensory systems, and especially vestibular processing. But if we're thinking about if, for example, if I have some tactile processing difficulties and I don't like to touch things, I don't like to be messy. I don't like food on my hands. I don't like paint on my hands. And I'm in an experience where I'm not only being forced to do some messy play, but I also am not being provided the tools that I need to wipe it off or to prep my body, or it's an unexpected messy. I might have a big reaction to that because my sensory system is overloaded and it's uncomfortable. So I think it's important to note that some sensory processing difficulties, a light touch, can feel very alarming. It sends us into that fight or flight mode, which is where I would say in schools, you can have a child accidentally brush somebody in line, and then the other kid turns around and decks them because they thought it was an alarming touch.
Does that include the food taste?
Mm-hmm.
Because I noticed that the texture, the smell, it's even the presentation of the food. We have two little kiddos that we are about to start our OT sensory management. So I'm asking, and I'm glad you have this class.
Mm-hmm. Yeah, absolutely. It can result in feeding, because if you think feeding is so emotionally charged, it's one of the most emotionally charged things a child does throughout their day. That, and I would say potty training, are the two like big emotionally charged events of childhood. But you're absolutely right. The presentation, so how it looks, the color of the plate it might be on, the color of bowl it's in, matter, whether or not the foods are touching. They're taking in so much sensory information before we're even asking them to eat a new food. And then we're getting to, is it a big flavor? Is it a small flavor? Is it a preferred flavor? Is it bitter? Is it spicy? Is it sour? There's so much sensory information in that mealtime. So yes, it all goes together.
Thank you.
Great. You're welcome. All right, so we're gonna hop now into sensory development. So sensory develop actually starts in the womb. In the first trimester, we start developing our touch receptors, our proprioceptive receptors. So muscles, joints, ligaments, all that fun stuff. I would say those are the two first ones to really kick in. Our next two are taste and smell. So those start developing also during the first trimester. And then the vestibular system starts developing in the first trimester as well. So lots and lots of sensory components start developing within those first weeks after conception. In the second trimester, our vestibular system continues to develop and takes off. And we start developing that auditory system, so our ability to hear. And if we think about it, those vestibular organs are in our inner ear. It makes sense that they developed in the same general timeline and together. And then our third trimester and after birth, our vision system starts that development. So our vision system really starts in the third trimester, and then as infants grow and develop in that quote unquote fourth trimester, so that neonatal phase after birth, their vision system continues to develop. So at birth, it says a child's touch sense is fully developed. It is really well developed. Our touch means so much to us as infants. It's how we are able to survive. So if that tactile sense isn't fully developed or well developed or needs support, you might start seeing that as early as 1 hour old, 1 day old. So what does this touch sense do at that age? It helps with rooting. So we're able to find and latch onto our food source. Our touch sense gives feedback for our suck, swallow, breathe. So our ability to eat and consume, and then we have that the reflexive grasp. So if you put your finger in an infant's hand, it automatically closes. And these are all protective reflexes. It's how we as humans have survived this many years, is because of these reflexes that we were born with. We know how to do these at birth. And then our touch also helps with bonding with our caregiver, right? Our little ones like that skin to skin contact, and they enjoy, you might say some of them enjoy being held, or they enjoy that cuddling. And then touch also makes them feel safe. It's protecting. At birth, we also have a pretty well-developed sense of taste and smell. So this is how, I don't know if you've ever heard of an infant knows someone else is holding them because it doesn't smell like mom. Or they know the difference between formula or breast milk in that bottle. They have a developed sense of taste and smell. They go towards those sweet tendencies, but they have the capability to know some of those subtle differences. And having those developed senses of taste and smell help with feedings, as well as identifying their caregiver. So identifying, okay, where's my mom? Where's my dad? Where's this person that is placed in my life that I know is gonna make sure I get fed, that I get changed, and help me sleep and help my body regulate. They start very early on knowing who their caregivers are and who those safe people are. Sensory regulation, it can show up, again, it shows up in infancy. So it shows up as a wake time. It shows up as fussiness. It shows up as difficulty with sleep patterns. So we can see that, throughout the infant stage, their ability to regulate and integrate all of those sensory systems already starts playing a role. An overstimulated baby can sometimes appear as a good baby because if you take them out into a really busy environment, they fall asleep. I'm going to say there are good things and bad things. I don't want to say good things and bad things. There are pros and cons to that. And it's learning how to navigate that and also supporting your baby with that just right level of arousal in the time periods, and then also knowing how to support them when they're fussy or they need sleep. I saw a hand
Yes.
pop up.
Leah?
It's my husband.
Yeah, and on the touch and reflex and the bonding with the baby when they were born up to the 3rd trimester, going to the 4th trimester, when the baby got detached from the caregiver, what happened after that?
From the mom. You mean?
From the mom, or whoever's the caregiver at the time. They lost that bonding and the relationship. What happened to those sensory things they have?
So there's a lot of different research. Our brains are so plastic in those first 3 years. And what I mean by plastic is we can change the brain. So we can override experiences that may be negative or maybe haven't happened, which is why early intervention and like early start programs are so important. Because really those first 3 years of life, we have the ability to change the brain. So we have the ability to work with professionals and use play as a medium to help set these kids up for success in their future.
Thank you.
Of course. So we're gonna keep rolling over the first year of life. So in about the first month, infants can see about 12 inches in front of them and they start recognizing faces, especially those of their familiar caregivers. So people that are routinely with them day in and day out. And they start tracking objects a little bit later than that. I would say like 2 to 3 months, they'll start turning to sounds, they'll start turning and looking for mom or dad. So we see that visual system develop over that first year of life. And then similarly, that hearing system, they have difficulty at birth hearing some really soft sounds. And so in the first couple of months of life, that acuity kicks in. So they're able to hear softer sounds as they get a little bit older. And that continues to develop. Our sensory system impacts our developmental milestones. 100%. If we have difficulties with, we'll say, our vestibular system, we might not want to roll over because we might not like how that feels, and we might not know where our body is in space for rolling. It can impact eating. As we mentioned before, even like before we get to eating, before we get to putting the foods in our mouth, if it's a big smell or visually it is overstimulating for us, we might see a big reaction. And that's where our emotions come in. So trying to navigate that self-regulation and trying to really figure out what's going on inside our body, because we're having trouble inside our body. So the outside world seems so dangerous. And we see these big reactions from kiddos that may have some difficulties processing sensory input. Another kind of residual piece we see is it could be resulting in limited attention. So the ability to play with the same thing for more than a minute could be a challenge, and something that we have to work through our sensory system to increase that attention. It impacts play skills, because if we have limited attention, we're not really moving around our environment and exploring. We're not engaging in those play activities or getting access to some of those toys to learn new skills. And then finally, our sensory system can impact things like sleeping. So if we have this heightened state of arousal, it can be really difficult to fall asleep at nap time or at bedtime. Or on the flip side, it could be that we just like to stay asleep a little bit longer. And so falling asleep isn't the issue, it's sustaining that wake cycle and staying awake long enough to go through some of these sensory-based experiences to help with development and play. So again, I wanted to highlight for our sensory systems, it's a range, right? There's not a good or a bad place. We all have these sensory systems. We all have a range that, maybe we're a little under aroused. We have our range that we're over aroused. And then we have our range that is that just right, where we're maximizing our learning, our attention, our development, and our participation. And so when we're thinking about a kiddo with some sensory processing difficulties, that range of where they're maximizing their participation is a little smaller. So it's helping them find that just right space. And then on our end, as the adults in the world, increasing that just right space. So what experiences promote sensory development? Tummy time. That's for little infants, number one. In tummy time, we work on that proprioceptive system. So we're really getting feedback into those joints, those ligaments, those muscles in our body by having to learn how to push up, having to learn how to, reach out of our base of support and grab an object. We're also activating our vestibular system because we're picking up our head. If we're in tummy time, we might be starting those pre-rolling skills or rolling over. So we're activating that vestibular system. And then our visual system goes along with that, because we're looking around our environment, we're getting some independence. And then for our tactile system, we're able to touch and explore at our own pace. So tummy time is such a great experience for infancy that helps develop and promote sensory development. As we get a little older, crawling is the most important. If you come see me and you tell me your child has skipped crawling, you're going to see things like tunnels and ramps, and we're going to pretend to be puppies, or we're going to pretend to be kitties, and we are going to be doing a lot of crawling together. Crawling really also promotes sensory development. Again, we're thinking about that head position and just the head control to be able to pull your head up. So your head extension, your head flick, or your head flexion. So looking down at the ground, moving left and right. And so it's a really natural way to facilitate that vestibular system We're getting feedback in our joints and our muscles and our ligaments. So our proprioceptive system is getting a lot of input through crawling. Our tactile system, again, a lot of input because our hands are having to touch the floor and we're going across different mediums, whether it's mats or textured, different cloth materials for the tunnels. Really, there's just a lot of sensory input that tummy time and crawling give. And again, if we think back to that pyramid, it was touch, vestibular, and proprioception at the base. So really those two activities, tummy time and crawling, really help build those foundation layers. And then they also integrate, you know, all of the other senses as well, our vision. We're going to smell some different things when we're in those positions by the floor. So we've got lots of different sensory experiences that come through those. Another experience that promotes sensory development is self-feeding. I just think of the messy baby. It's okay, and I would say don't be afraid to get messy because that's how they're exploring those foods. So they're exploring them by how they feel, how they look. What does it feel like in my hands versus on my cheek? So they're getting a lot of sensory information from the food before it ever goes in their mouth, so that when it goes in their mouth, they have a better idea of how to navigate it and how to eat in a safer way, because they've already explored so much about the texture and about how it smells that, you know, it's deemed safe to go in their mouth. And then I love good bare feet. So again, it's feeling those different textures, whether it's going to the beach and touching sand, playing out in the grass in bare feet, walking between hard floor and carpet. It's just a really easy way, without doing too much to change anything in the environment, to gain some different sensory experiences as a infant and toddler develop. So we're also looking for freedom to explore. So that's where tummy time and crawling come in. These are obviously, they're facilitated when they're really young. So we do facilitated tummy time. And we also help build those muscles up when they're really tiny. But as a child grows and gets better with tummy time, it's a really great opportunity for them to explore the environment. So we can place some toys around them or some different sensory experiences around them so that they can do them at their own pace. They can learn to explore and engage, and they can roll and kind of shift their bodies and learn how to move through space. So it really gives them that freedom to explore the different sensory input. And then the natural opportunities. So by setting up an infant or a toddler in a play area, we can really craft and curate exactly what we're hoping to achieve as the adults in their world. So we can provide them with opportunities to explore different sensory inputs. So it could be they really love balls. So you can get something like a tennis ball that's a little fuzzier. You can get one of those like spiky balls. You can get a ball that lights up. You can get a ball that vibrates. You can get a smooth ball. There can be bumpy balls. There's all kinds of different sensory experiences we can facilitate through these toys. So it's giving them the opportunity to explore and engage with these materials and these toys throughout play. So again, just highlighting before they turn 3, or that we have a special window, not just for sensory development, but for development in general. So our brain is really, it's learning and taking in information from our environment and trying and exploring new things all the time from birth to 3 years old. So it is such a critical window for development that we have before they turn 3. We are so lucky that we have great early intervention in California with Early Start and it matters. It is we can set these kiddos up for success by getting them in services and getting them evaluated. If you see something that you're like, I'm not quite sure, that seems a little, it's different than my other child, or it's different than a peer I see, it doesn't hurt ever to get them evaluated, because early intervention can really help set them up for success for the rest of their school years life. And then it's such a critical phase, again, not just for sensory, but for all areas of development, because we have the capacity to change and shape, we have the capacity to change their brain and really shape those experiences that they are going through. So what can we do at home? I would say absolutely, if you have sensory concerns, consult with an occupational therapist and your pediatrician to help really get some more insight to what is going on with your kiddo, and just to learn more about how they're learning and experiencing the world around them. But there are also things we can do just naturally at home to help increase that sensory, like making it a sensory rich environment and helping them learn and play. So I digress, and yet I don't know if you've picked up, tummy time is so incredibly important. It supports the development of vestibular, proprioceptive, tactile, and visual senses. It helps a child learn where their body is in space and provides opportunity to touch objects. So you can, maybe there's like a crunchy fabric that they're on, maybe it's a soft fabric. There's so many things we can change about this experience that helps with engaging in their sensory systems in the world around them. One piece of feedback I get a lot from parents is, my child doesn't like tummy time. Well, I don't like to go to the gym either. Tummy time is hard work. So I don't want to undervalue how hard our babies are working when they're doing this. If they are doing tummy time for 1 or 2 minutes, that's a lot of work. Our goal would then be for the next week or in 2 weeks to increase it to 3 minutes. But we don't start off running a marathon when we're training for it. It starts with that first mile. So that first minute is where we start, and we just build on it and make it longer. And we challenge them each and every day to add a little bit more, right? So if they're only doing tummy time for 1 minute, maybe they have 4 or 5 opportunities to do that 1 minute throughout the day. You do it after that first feed, after that's, or I would say not after feed, that's not a good advice. We want to keep their feedings down, but before that first feed, before that second feed, before each time they're eating, or maybe before diaper changes or after diaper changes, whatever works best in your routine. It shouldn't feel like a chore. It should feel like something that's just kind of naturally, it's how we play and we engage every day. So you want to figure out what fits best for you and your family. But tummy time. And if you have an older child that, say, maybe isn't in that infant stage, you can play on your tummy. So you can do board games on your tummy. You can do coloring on your tummy. You can do puzzles on your tummy. You can play with cars on your tummy. You can do shape sorters and blocks. So just because maybe they're not in that infant window, we can still lay on our stomachs and play and engage with the world around us. We can do things that help with the sensory development. So rolling, your infant might be learning to roll, or you might have a toddler and you might be pretending to be logs and rolling down a hill. You can do, like, you can incorporate rolling at any age. And the same with crawling. They could be in the stages of learning to crawl, or you can do an obstacle course and crawl under the table, crawl under the chairs, over pillows. They can pretend to be cats or dogs or dinosaurs. Whatever, they could be trains, whatever is really motivating and playful to your child can be incorporated into crawling. Other activities, exposure to a variety of foods, and there's my messy baby picture. That baby has fully experienced the smells, a little bit of the taste, felt the texture of the noodles, the sauce, and just has had a full body sensory experience before that food went in the mouth. And again, just don't be afraid to get a little messy. It's how we learn and develop and play, and make feeding not feel so emotionally charged. I know as a parent, our job is to help this child grow, and we need them to eat. And so sometimes, we're just like, I just need you to eat, but remembering they learn best through play. So making it fun, making it entertaining and exciting is a great way to explore those sensory components of new foods, so that it doesn't have to feel as high stress or as scary for them. So at home, we want to provide sensory-based experiences through play, through positioning, so tummy time, crawling, all that fun stuff. We want to encourage sensory exploration. They are looking to us to know if something is safe. So it's giving them that support that even if you can see they're a little hesitant or nervous, that it's okay, you can touch it, or narrating that experience. That really was weird, huh? It felt slimy, it was wet, that was a big smell. Because a lot of our kiddos, they get receptive language before that expressive language. So they're taking in what you're saying. So just narrating what you're seeing happening. So they feel seen and heard. And then as adults, it's our job to teach them about the world and how to explore the world around them. So there's a lot of different things we can do to help teach them about the world around us. And we can teach them through scaffolding. So there's a famous psychologist from the 30s named Vygotsky, and created this theory of zone of proximal development. So what does that mean? It's about helping them get to that just right zone. So that just right piece we were talking about before, we're going to use it for teaching our children. So it's helping them and giving them just enough support to where they can do it on their own. And then we slowly back off our support, and what they're doing on their own is a little bit more. So it's teaching them how to engage in an experience. It's teaching them how to do something, and teaching them a task. So it helps them do something that's a little bit too hard for them, but with mom or dad or caregiver support, we can help them do it as independently as possible and make them feel successful. For me, I know that if I'm doing something over and over and over and I'm not successful, I'm going to get frustrated. I'm going to get a little dysregulated. I'm going to be done with it. But if I have support from whether a peer or a mentor to help me along the way, even though it's out of my reach, even though it's too hard for me, having someone that has that expertise and that can help me push me a little bit beyond what my comfort zone is, but also making sure I'm successful. I'm going to keep engaging and keep practicing until I can actually do it on my own. We all, like our sensory systems, we all have our different zones of proximal development. So we all have our just right learning zone, and it's not the same for me as it was for my brother, as it is for my sister. Like, we're all very different in where our just right learning zones were. And you can begin scaffolding so early on. And so even things like tummy time, if they're teeny tiny and newborns, you can do it different ways. You can do it tummy to tummy so that can go hold at an incline, so it's not completely flat. They're still cuddling. It looks like cuddling with mom or dad or the caregiver, but they're already working on tummy time. So we're scaffolding that experience to meet them where they're at and to challenge them just a little bit more so that they can then do more of an experience. So an example could be, you know, when you're playing peekaboo, they make eye contact and look away. So you can, you know, pull up a blanket and go, where's mommy, where's daddy, where's grandma? And then uncover and say, there's mommy, there she is, peekaboo. So we're really teaching that concept of object permanence, and we're increasing that challenge. It's not just using my hands anymore, I'm using a blanket or a dish towel or something different to help block that visual field. Another way to scaffold is if a child is unable to verbally request. So they grab your hand and take you to where they want to go. They point, they might be screaming, whatever method they use to communicate, I want this, I need this. A way to scaffold is you can model the word, oh, apple, that's an apple. Oh, you're thirsty, you're looking for your drink, here's your drink. And then you can give them the opportunity to imitate as well. Oh, you're looking for your water, you know, you can try water. And whether it's the sign or it is, they say, wow, you know, oh, great, you said water. And you can give them that water. So it's really just helping label and identify and make those requests. And for some kiddos, you know, the first time you do that, just looking in your general direction is increasing that attention and that scaffolding. So it doesn't necessarily mean it has to be, they go from not saying the word to saying the full word and we're holding out. We do want to wait for that joint attention, but we want to, again, meet them where they're at. And that's where your speech therapist, your child development specialist, your OT, your physical therapist, infant stimulation, everyone is here to help you. All right. So I had some help putting together some fun fall activities and resources. So these are just some ideas of things you can do, and you know, you can always change them too to meet what you have available, but this is just a springboard of what some sensory activities can look like this fall. So painting with apples. So you can cut an apple in half, you can dip it in paint. It's a really great way to get exposure to the texture of apples, to how they smell, to how they feel, without actually putting the demand of consuming the food on them. So you can do some stamping and some painting. Depending on how you cut the apple, you might get a star for the centerpiece. Or by a star centerpiece, like it'll leave a star imprint in the center. So you can get some really cool things. And then you can also use beans to, you know, paint, make the seeds. You can glue them on for a multi-texture picture. So again, we're looking at engaging and playing with different textures. So glue is a little sticky, paint is wet. And so it's challenging that sensory system along the way. Other things you can do is you can count with the beans, you can practice scooping, you can practice picking them up and putting them in. So there's lots of different ways we can play with the same materials all at that time. And then you can also use things like those little pom-poms, googly eyes, whatever you have around the house. If you have an acorn tree outside, you could grab acorns and do the same thing with the painting. So lots of different ways. Again, you want to make it work for you and your family, and also help just gain some exposure and experience to some of these materials that may be a little bit different than what you're using every day. Another fun activity is doing a scavenger hunt. So you could do this inside the home. You could do it on a, a little walk or family outing. You could do it at the park. So you could I spy with my little eye something red. It could be an I spy game. Or you could be looking for different leaf colors. We don't quite get the same array here in Southern California of the fall leaves, but there are some. So you could be looking for yellow leaves or red leaves or brown leaves, something that's different than the traditional green leaves. You could, and I mean, with the leaves, you can hear the rustling, you can hear the crunch as you step on them. You could be looking for a bird and you have to hear it, and then you see and point and look and really engage in all of those senses while going on that family walk and throughout the day. So there's just a list of different things you could look for throughout fall. Some of them have smells like pumpkins and apples and flowers, and other things, you're listening for or you're looking for as you're engaging. Another idea is you can paint a pumpkin on a disposable plate. You can paint with a paintbrush. You can paint using your fingers. You can paint using sponges. There's so many different ways you can paint that plate and really work on that sensory system. And then you could also color it. You could use crayons. You could use markers, which might get a little bit on you. So if your kiddo doesn't like to get messy, maybe markers is the way to start, because you'd get just a little bit on you versus, we're diving right into finger painting, which could be really aversive. You could use dot markers. Really, the world is your oyster as far as coloring materials. And then you can create the pumpkin inside, or I joke with my kiddos in the clinic, the pumpkin guts. And you can glue on the seeds. You can draw the seeds. It's just a fun little craft. So lots of little crafts incorporate different sensory components, especially once you get into like cut and paste, because they have to navigate either way, like the squirt glue, glue sticks, glue dots, tape. And then again, you can scaffold that sensory experience based on their level. So whether it's, if you're afraid paint is going to be too overwhelming, you could scale back to something like dot markers or markers to where they're still getting a little bit of that tactile sensory experience. Or if squirt glue and that white Elmer's glue is aversive, you can, go back to a glue stick that has a little bit more control, but you're still engaging with that sticky component. And then if cutting is a challenge, the adult can do the cutting and the child can do the sticking on. So there's lots of ways to scaffold that experience to meet them where they're at and still get to this product. Sensory bins are fun. You can fill it with like a plastic shoebox or a plastic box or a shoebox with a variety of items. It could be, it doesn't have to be something like beans or candy. It could be leaves, pine cones, twigs, something you find on your walk. And then it's just a fun way to explore the textures. You can pretend, okay, I'm going to find the car, and you're going to drive the car down into the sensory materials. And so then they have to go in and they have to find the car. You can have the car like partially buried. So we're really starting to challenge not just their tactile and like systems, as well as maybe getting some deeper pressure and engaging those proprioceptive systems, but we're also challenging their visual system, right? If an object is halfway hidden, being able to be like, oh, I can see the car wheels, that's a whole car. So helping make those connections for them. And you can also, you know, depending on what it smells like, it could be a sensory experience. So there's lots of different ways. These sensory bins can be a fun experience. And then if we are scaffolding that tactile experience, so maybe they don't like to touch what's in that box, we can use things like tweezers, tongs. It doesn't have to be these on the screen. I've worked with kiddos using like the kitchen tongs for cooking to pick something up to get their car out of a sensory bin. So we're working on that fine motor, obviously as an OT, but we're also scaffolding the experience. So they're engaging with the sensory box, even though they don't love what's inside, and they're able to get those toys out and engage and play. And then Play-Doh. Play-Doh is a fun one. You can stick objects in, you can pull it apart and make little balls, and you know, we can count together. Oh, this is 4. 1, 2, 3, 4. You can make numbers, you can make shapes, you can make letters as the adult. And just, it's a different way to introduce counting and letter sounds than I would say like the traditional flashcards, because you can really touch and feel and manipulate it. Like, oh, we have 2, but now I pulled this. We had 2 balls, but now I pulled one apart, so now we have 3. And Play-Doh is typically a pretty fun activity. And if we're thinking about tactile system, you can push it so you can get deep proprioception. You can activate those deep touch receptors. And it's, I mean, it has kind of a filmy residue, but overall it doesn't really stick to you. So it's, I would say it's considered like a safer tactile material rather than like paint or glue that's going to get on you and stick on you. So it's a great way to introduce tactile play to your little one. All right. Thank you so much for coming today and for having me here to talk about sensory development. I'm here for questions.
This is the time, ask questions. We have another at least, oh yeah, good 15 minutes.
Like 10, 15 minutes, yeah.
Yeah, so it's open up to everyone. They have questions?
I have a question.
Yes.
My little one, I guess he's very active, like very, he doesn't have much issues with like touching stuff, but he just runs. He likes to run and he thinks he's Sonic. So there's sometimes purpose behind his running. How do I use the sensory like to calm him down? Because I feel like he just has energy, he just wants to run. Does that make sense?
Yeah.
And they keep on saying that's sensory based.
Heavy work. So incorporating things like crawling, jumping, I would say your occupational therapist
Yes.
would be able to help really
Okay.
tailor a program that's specific. But I would say going back to those heavy work activities where we're incorporating crawling, jumping.
Crawling and jumping. Okay.
And then they'll be able to really tailor it down for you with additional activities and ways to get that heavy work in.
Okay. Perfect. Thank you.
Yeah.
Yes, I noticed that there are some age group that that Dr. Baily, is that okay? Dr. Baily is mentioning. How about after age 3? You know, like 4, 5, 6. That age group.
I'm going to say we have sensory experiences throughout the lifespan. And like I mentioned, our sensory system is like a wave. So whenever we are presented with a challenge, we can see some increased sensory difficulties, right? So if they're, for me, if I'm going to have a really stressful week, I have to make sure that I am getting my sensory input. So I have to make sure that I am prioritizing working out so that I can navigate those stressful situations and show up as my best self. The same thing for these kiddos after 3. If we know we're going to be setting them up for something that is really challenging, we want to make sure we are making sure their sensory system is just right before putting them in those situations so that we're setting them up for success. The same way we were thinking about the Jenga tower at the beginning. The Jenga tower is with us for life. It never goes away. So always tightening up before those higher level experiences that we're really going to be challenging how tall we're building our tower is important throughout the lifespan. And it's important for all of us here.
Yes. Just to let you know that your class is very, very informative. We have 2 kids, our foster kids, that is one of them is on this right now. Well, we're going to start our sensory occupational therapy, and it's very informative, just how everything that they do is related really to sensory, their sensory processing. The only caveat for us is because we have other problems. We have other problems, with the kids. So we have to be careful with paint or the markers or anything small because they bite on it or anything like that. So we just do the best we can. And one thing to add on to that is we're very grateful for the school system that because they go to school, specifically the Head Start Educare. They have an awesome program, and that's where the kids pick up all of this that you're saying, sense of touch, sense of smell. They have a little garden, that they go to, and they've seen how the flowers bloom and pick up the bugs. Insects, and they love bugs anyway. So I mean, those are the things that really, as you are saying it, we kind of relate a lot to what you're saying, and we just smiled and we said, oh yeah, that's Danny. He's touching everything, just like this morning I'm slicing the fruit and he just have to touch it, and he's 5 years old. You just have to touch it. If it's not touched, he picked up the leaves this morning and he said, Mama, smell this. It smells so good. To him, it has a smell. To me, it doesn't have a smell. So that's okay.
So
So
glad.
thank you very much. You're awesome.
I'm so glad that you were able to relate with so much of the
yes.
content.
Oh, yes. We would like to have more of your classes in OT, which is really good for us. It helps us a lot to understand how to, manage our kids too.
Thank you for sharing that, because this is Early Start is really close to my heart, because my daughter, even though she's now 21, she started in Early Start when she was 18 months. And she had a lot of sensory going on. I mean, even with the birthday song, that was really tough for her to hear the birthday song. It was so important, Early Start, because the actual place that we receive services were able to help us, like having, different workshops like this, but how to incorporate that at home, how to get to a birthday party, learn to go early instead of right when it's in full swing. So a lot of tips like that. And that's why I really enjoyed reaching out to the vendors and asking, hey, is there anyone here with Early Start that would like to put on certain presentations that we know a lot of the families would be interested in. So this has been like a series. And we've had toilet training. We've had now, today with the sensory, and there'll be more definitely next year. So listening to what you said, Mom, about what you're looking for, maybe some more OT workshops, I'll make sure to take a note of that. But I also wanted to say thank you so much for your husband to be here. This is huge when I think when you have everyone on board that's all doing the same thing, I really believe helps our kiddos as well. I'm just speaking from a personal, because I am not a I'm not an OT, but I had to learn. I had to learn. And I
Yes.
think, yeah. So
Yes. And one thing more is the main component of one of the problems of the kids, like ADHD, autism, ASD, is one of the main component, sensory development. I think Dr. Zubel mentioned it in the early part. I didn't catch it well.
So sensory can stand alone. Sensory processing difficulties and sensory development can stand alone, or it can be in conjunction with something like ADHD or autism. So it really is unique and individual to each child and each person. How we all see and experience things is a little bit different and personal to us. So I would say yes and no. It can be
Okay. Okay.
it's all
Can
of
be,
it.
couldn't be.
It depends.
Yeah. Okay. Yeah. Okay. Okay. It makes sense. I just, would like to just to mention that just to have to ask it,
Word.
it's because it shows. Okay. Thank you.
You're welcome.
Any other questions? We have about 5 more minutes. Oh, wow, I'm sounding like a teacher. 5 more minutes. I caught it in my voice.
Then I would like to be on your list for your other classes regarding OT and sensory development. If you would, please. I just came across this last night.
Oh,
So,
nice.
yesterday evening, and I signed up and I said, oh, this is what we need. We've been attending so many classes and we haven't, I'm surprised, the other, I wouldn't mention, but we haven't had a specific sensory development class. And it's very, very important, I would think. I think it's one of the top that everybody and caregivers and everybody should know, not even for fostering, but for your own child.
So I put in the, I'm not sure if you saw, I put in the chat box and I think I emailed you directly also, the family focus.
Yes.
So on
Yes,
that
I got that.
website, all of our upcoming workshops
Yes, I
will
got
be
that.
on there. Right, and if you sign up for the newsletter, you'll also know before a night before, hopefully.
Okay. Okay.
And then for those families that, I think there's maybe a couple of service coordinators, at least 1 or 2, I think, maybe on the call for your families to let them know that this presentation will be something we thought of down the way once COVID hit, is that we know everyone can't be on in the mornings or in the evenings. So we are putting the recordings on our website.
Yes, and I will suggest that also to our DCFS.
Thank you.
DCFS, maybe social worker, I don't know who's there in charge, but it is really important, that they have to include this. And specifically, sensory stimulation should be by itself a class for the new caregivers, for fostering. Even parents are welcome. I think they should put emphasis to it because you've seen so much learning on this. And I don't know, are we just overlooking the other ones? That this is one of the most important on the first 5. California is talking about first 5 years. And I think they should by itself address the sensory development by itself, not together with the other classes, because then, you forgot the details of things.
And I think we should recruit you because you are awesome. I think First 5 needs you as a speaker, Family Focus, Regional Center. You are the parent that will make sure things will be happening for your kiddos and passing the word. I'm sure Dr. Baily and some of the others on here will agree. So I will definitely be keeping your email address.
Yes. Well, my background is I'm an EQ nurse for so long, for over 40 years, and I work with OTs. And when she was saying all of this, I said, darn, I know this, but why are we not putting this on the board, to address, to help others, I just happen to know some of it, or some of it, not totally. That's why I was like appalled. I said, oh my gosh, I didn't know that it's related to that, blah, blah. But we teach all of this, to our prematures. I take care of prematures. I take care of this. And we do most of it. It's just so happened, that it's not really out there, for teaching to parents, parents of premature babies, foster kids. And a lot of our foster kids also have problems, with drugs and history of drugs and alcohol and all of that. So why is sensory development not out there like the rest of the classes that we're attending? We attended so much classes, believe me, it's a lot. But this is a very specific class for sensory development, which is really important for the child mostly. Good
Thank
job.
you. Oh, yeah. Dr. Baily, and I know it's actually her last name is Zubel. So
Yes,
I want to make
Zubel.
sure that I say that as well. Thank you so much.
Thank you.
And also, yes, so there's been questions about, I know we'll have the recording on YouTube. Are you able to share the presentation as well, Dr. Baily?
I can look at that. Yeah.
Okay, so yeah, if you can send it to me, then we will upload it as well. Yes. Well, thank you everyone so much. Don't forget our All Abilities Resource Fairs. Saturday, October 23rd, we'll have a lot of different vendors. You just go into booth, ask questions to speech therapists. We have entertainment. There will be people that serve our community, different vendors, sponsors. So make sure you stop by. And I did put the information in our chat box. So again, thank you so much, Dr. Baily.
Thank you.
Zubel.
Thank
Bye,
you.
everyone. Thank you,
Bye.
Leah, and your husband.
Okay. He's making his second cup of coffee, so it's okay.
Bye-bye,
Thank you.
everyone. Thank you for
Bye-bye.
joining us.
Bye.
They're so cute. I love families like that. They're so involved, and it's always nice when I'm going to stop the recording here. Okay.